Welcome back to Daytime. He's considered one of the world's top surgeons, treating patients from all over the world. He's written a book with his son, The Complete Hair Replacement Guide. We welcome Dr. Robert Jones. Thank you for joining us.
Glad to be here.
So how does hair loss happen?
Well, the most common cause of hair loss is genetics. And basically, if you've got a gene on your dad or your mom's side that causes you to lose your hair, then when you start to get testosterone, which is usually in your late teens, testosterone is converted to DHT, which is another hormone, and your follicles will have receptors on them that cause them to stop functioning. So over time, you'll start losing your hair on the top of your head, and it's basically just a hair loss gene that causes it.
Let's talk about that's in males for baldness, but how about with females? Just want to know if we're represented in hair loss.
Because that's interesting too, because it's not only males that can lose hair; females can also lose hair.
Definitely,
as well.
it's a huge part of my practice is seeing females, and female hair loss. Although male hair loss probably gets more press, it's much more devastating for females to lose their hair.
Really?
And it is a big part of my practice, and it's awful to have a woman in her sort of mid-40s who has had a thick head of hair for years and starts to thin out, and definitely can be devastating, and usually again is hereditary. There's a whole sort of list of other causes that causes female pattern baldness, including high testosterone levels, low thyroid, but again the most common is still hereditary.
Is treatment different from male to female, or is
well,
the
yeah,
same?
it's
How does that
usually,
work?
well, again, in females, there's probably a higher incidence of medical causes causing hair loss, and for that reason, both males and females should be investigated for hormonal abnormalities and other things causing hair loss before you consider sort of medical or surgical treatment. So, definitely they are. It is common, and there are treatments, and the treatment patterns do differ from males to females for sure.
How does a hair replacement consultations begin?
Well, I mean, basically, if somebody comes in because they're losing their hair, the first thing I do is sort of try to assess whether they've got male pattern baldness or female pattern baldness, or whether it's caused by other reasons. And then once sort of I assess that, the first thing I do is discuss there are some medical options. There's a couple of FDA-approved medications that can stop you losing your hair, and then the final thing to consider would be surgical therapy. I actually had the procedure done.
I wasn't sure if we could talk about that. You are not only a client, but
I
you are the president.
I brought a picture of myself. This is about a year ago. I actually had a hair transplant, and you can see quite a bit of difference there between sort of a year ago and now. It was last February 20th.
Wait, can I stop you? You said quite a difference?
Don't you think there's a difference?
Quite a difference. I think that's an understatement.
A huge
Yeah.
difference.
difference.
Yeah, I've got more hair now. Yeah.
Okay.
So
Let's talk about your blog. You also have a blog. We'll get
That's
more into
right.
that, obviously, after the break, but
Yeah.
just to let people know that they could also go to your website.
yeah, they could go to my website. I actually have a blog that covers sort of the day-to-day process.
You're not counting hairs every day, are you?
No,
Oh,
no,
okay. Today I have one more today. No.
Oh, yeah.
No, I mean, basically, the reason I put the blog on there is that people have questions about, what's it like the day of the surgery, what's it like the night after the surgery, the week after the surgery, what happens on a day-to-day basis. And I thought just as it was useful to my patients just to provide that information through a blog on my site.
Very good.
Well, stay with us. We will have more about transplanting and the new book from Dr. Robert Jones.
and welcome back to Daytime.
Well, before the break, we were talking about your blog on your website.
Yeah.
And it kind of helps people who are experiencing hair transplant to kind of see what to expect, right?
Right. I mean, people that come in, you know, they've always got lots of questions, and they're always wondering, you know, does it hurt, and when can I resume exercise, when can I go back to work, and all those sorts of things. And by me giving a day-to-day account of just what I went through myself, then I'm able to sort of provide that information through a personal experience to my patients. As well as that, I think I've got about another 6 or 7 patients on there that have also provided that on a daily basis, which I think is very useful.
The blog is growing.
Well, I usually get patients.
Yeah.
The blog is growing.
The blog is growing.
Yeah. Let's talk about your book, The Complete Hair Replacement Guide.
Yeah.
What can we expect in your book?
Well, basically, the book I wrote with my son in the fall, just basically to provide the latest information on causes of hair loss, just generally about hair and sort of anatomy and physiology of hair, medical treatments of hair loss. Also, it's hair loss, generally speaking, is a multi-billion-dollar industry in North America, and most of the treatments that are used don't work. And,
really?
And there's a lot of sort of natural treatments and shampoos and a lot of things that make no difference whatsoever to hair loss. There's only basically probably 2 or 3 things that actually have been proven in double-blind controlled trials to make a difference to people that have thinning hair. And so what I've tried to do is cover a lot of the myths around hair loss and a lot of the myths around treatments for hair loss.
And what are some of those myths?
Well, I mean, a lot of people think wearing a hat is going to cause...
I do hear that a lot, because
right.
you think your head is going to suffocate or your hair is going to suffocate. It can't breathe.
Not true.
Well, you tend to sweat underneath the hat. I know I do. So.
Yeah, but that makes no difference whatsoever to hair loss. The other is cleanliness. Some people think if they don't wash their hair and if they don't clean the pores out, the hairs won't grow properly. But
not true.
Not true at all. If you take a look at the Eskimo population, who literally they don't wash their hair for 4 or 5 months of the year,
full head of
basically, and they have the thickest heads of hair of anyone in North America. And so, in spite of not washing their hair for half of the year, they don't.
Well, that doesn't mean I should stop washing my hair.
No, all I'm saying is, yeah. But it just makes no difference to whether you lose your hair or not.
Right.
That's all. So there's a lot of myths that I kind of go over, and a lot of things that people think and they just aren't true. So try to dispel some of those myths.
Okay. Well, we'll talk a little bit more about your book, and we'll talk about your clinic as well, and the procedures that we can go through. We've got to take a short break.
Okay. Sure.
We will be right back on Daytime with Dr. Robert Jones.